Module Overview. Nutrition and dietetics are integral pillars of preventive and therapeutic nursing care. This module offers a comprehensive introduction to the principles of human nutrition and dietetics, tailored for you who preparing for healthcare roles within the EU. It emphasizes the physiological roles of nutrients, dietary planning, therapeutic nutrition, and the nurse's responsibility in assessing and managing patients' nutritional needs. In the healthcare setting, malnutrition, obesity, dehydration, and dietary deficiencies are common conditions that negatively affect health outcomes. Nurses are often at the forefront of nutritional screening, feeding assistance, enteral nutrition administration, and patient education on dietary choices. This module aims to help you understand nutrition not just as an isolated science, but as a dynamic clinical tool used in promoting recovery, preventing disease, and supporting general well-being. It balances theory with clinical applications and includes European food policy guidelines, cultural dietary norms, and evidence-based practices for managing nutrition across the lifespan. The module is designed to meet international educational standards and accreditation frameworks for nursing education, including alignment with EU healthcare regulations and World Health Organization recommendations. 1. Introduction to Human Nutrition. Definition and scope of nutrition, difference between nutrition and dietetics. Nutritional science and nursing integration, the role of nutrition in physical, mental, and social well-being. The food-nutrition-health relationship. 2. Macronutrients and their functions, carbohydrates, sources, types, simple, complex. Role in energy provision, proteins, amino acids, complete versus incomplete proteins, tissue repair, enzymes, hormones, fats, lipids, saturated, unsaturated, trans fats, functions in cell membranes, insulation, energy reserve, water, fluid balance, temperature regulation, cellular transport, clinical implications of deficiency, excess, malnutrition, kwashiorkor, marasmus, hyperlipidemia. 3. Micronutrients and their importance. Vitamins. Fat-soluble, A, D, E, K, water-soluble, B complex, C. Minerals, iron, calcium, potassium, sodium, zinc, iodine, magnesium, their biological roles in immune function, bone health, neural activity, etc. Deficiency syndromes, rickets, anemia, scurvy, goiter, supplementation protocols in clinical settings. 4. Energy balance and nutritional requirements, basal metabolic rate, BMR, total energy expenditure, TEE, body mass index, BMI, and interpretation energy requirements by age, sex, and activity level, weight management, undernutrition, overweight, and obesity assessment tools, food frequency questionnaires, 24-hour recall, food diaries. 5. Nutrition. Across the lifespan, nutritional needs in infancy, childhood, adolescence, maternal nutrition during pregnancy and lactation, nutrition for the elderly, managing sarcopenia, dentition issues, reduced appetite, cultural and religious considerations in dietary preferences, European food guidelines for different life stages. 6. Therapeutic nutrition, diet modifications in disease, diabetic diet, renal diet, cardiac diet, low sodium fat, high protein, high calorie diets, gluten-free diet, enteral, tube feeding, and parenteral nutrition basics, role of nurse in tube feeding, checking placement, flushing, infection control, case scenarios, diet and stroke rehabilitation, burns, pressure ulcers, HIV/AIDS. 7. Nutrition assessment in clinical practice, nutritional screening tools, MUST, SGA, MNA, physical signs of malnutrition, anthropometric measures, height, weight, waist circumference, laboratory values, hemoglobin, albumin, electrolytes, interdisciplinary collaboration with dietitians and physicians, patient counseling and education. 8. Hydration and electrolyte balance, importance of fluid intake, dehydration signs and prevention, electrolyte imbalances and nursing implications, fluid input-output charting, clinical management, IV fluids, oral rehydration, fluid restrictions. 9. Food safety and hygiene contamination, foodborne illnesses, HACCP principles, storage, preparation, and serving of meals in clinical environments, legal and ethical aspects of food safety, infection control during feeding procedures, regulation of hospital catering services,